Hello, so this week's video journal is on cultural competence as a provider, and the questions were specifically more geared to my experience as a nurse. I have had the opportunity to travel abroad into some Far Eastern countries and Middle Eastern countries, so I do have quite a bit of knowledge and understanding of various cultures, and then just Hispanic culture that is here, pretty prevalent in the area that we live in. I do understand more of the male dominated household, although that is changing generationally as those families continue to live in the United States for a longer period of years. However, specifically in my experience as a nurse, I think the most challenging experiences that I have are those when I have been in the company of Arab Americans, and whether they're male or female, obviously, if it's a male, it's required the presence of a female. Excuse me, if it's a male, it's required the presence of a male nurse. But when it's a female, it's been difficult in that I've had to always make sure that I have taken the time to run any care plans, treatment plans, or ideas through the husband or whoever the male figure of the household is. And so that's always challenging because I have not necessarily even, it's not my first thought because I run things through the patient. And a lot of times you think about patient confidentiality and am I even supposed to be talking to that other person? So you have to kind of get yourself ready in the chart and make sure that there is the proper documentation in place to be able to talk to other family members that are there. But because it is part of their culture, it's the expectation that anything that you want to do for the patient or any plans going further for the patient, specifically in the areas of wound care and things like that. When patients were being discharged from the hospital, you had to give instruction and give that information to a male, and sometimes that's a tricky situation because you're a female caring for a female patient, but then you're having to give instructions to a male caregiver, and that is not always taken well or appreciated. And specifically, the journal asks us just to reflect on ways how we have prepared ourselves for that or how we've corrected our deficiency. I think just making sure that you've read the chart, that you know about previous incidences that there have been, and then just being aware of the culture in general, knowing who your patients are that are coming to the office and what the expectation is there and what their specific culture is. Since the Arab American culture is not necessarily that open to mental health care, I haven't experienced any opportunities to see those clients in psychotherapy sessions with my preceptor or in just psychiatry appointments with my preceptor in my first term. So I don't have that experience as of yet. I'm hoping to have that maybe more as an inpatient status when I'm closer to the city of Chicago. That'll be an opportunity for me to put those skills into practice. And just as a psychiatric mental health nurse practitioner, how will I ensure that I'm continually learning to improve in the areas of cultural competence? It's just to always stay well-read. And I think living in a somewhat urban area close to a major city, that we are more exposed, and so we are maybe more sensitive to those topics because we are facing it more on a daily schedule or daily routine than other people might be, especially as we head closer into the city. And I always really appreciate the diversity just from my younger experience of traveling, as I mentioned, abroad. So staying well read and just being willing to learn and just admit when you're wrong, I think are the best things that you can do as a provider in the mental health care field. Thank you so much. Bye-bye.